My name is Robertson. I'm an employment specialist at Central North West London NHS Trust. I work within my own organisation, so my own organisation is the employer that I focus on. It's really useful to be kind of embedded into that organisation because it means that I can kind of make a lot of different contacts as I go, so it's a lot easier for people to kind of trust me and offer opportunities to the people that I'm working with. I think it's important to kind of stand in the middle a little bit, so you're kind of working for the clients that you're working for, and then you're also thinking about the needs of the employer, so thinking about their concerns, their fears maybe, and what kind of support they might need. But then I suppose coming down more on the side of your clients, because sometimes they're in need of a lot of support. So when I would get a referral, I will usually speak to the person who's referred or speak to the service user themselves and just have a chat about kind of what they're really looking for and whether I'm going to be the best person to support them. Sometimes they're better supported elsewhere, or sometimes they really fit the programme. Then I would arrange to meet with them and talk to them about lots of things, everything to do with, I suppose, their work, previous work history, what they want to do in the future, what kind of environment they'd like to work in, and what kind of they think their difficulties might be. So if they have a particular difficulty around kind of large groups of people or busy environments, then we try and kind of maybe go to quieter places, or that could be something that they want to work in and they want to be in a busy environment to kind of test themselves out a little bit, so we may look for those kind of things. I suppose a lot of the people that come to me, they're firstly just really motivated to find work, but sometimes they are a little bit fearful of jumping straight into employment, just because of a lot of reasons, things to do with their benefits, things to do with just being out of the workplace for a long time, kind of not feeling confident about it, maybe kind of having fear that they might fail. So sometimes what we do is organise work placements for them within the organisation. So we'll go to kind of different managers, different services to try and see where might be the best place for that person. So might have a look at what skills gaps they have. So try and find somewhere where they can get that bit of IT training that they need, or get that customer service training that they need. To try and make sure that kind of by the end of them doing that short work placement, that they have all the skills that they need to be able to apply for the job that they want to, and to be able to apply for it confidently. So if somebody did a work placement with us, then they would kind of get a lot of support from me. So I would kind of come in and do reviews with them, make sure that they're kind of getting the support they need, trying to organise other bits of training, either kind of training within the organisation or outside the organisation. But also they get quite a lot of support from whoever their supervisor is, or whoever the manager is. So that's why it's quite important that we have a lot of backing from the people within the organisation, that they kind of really, don't just have somebody to come in and work for them and just kind of forget about them and just let them do all the small little odd jobs, but to actually really kind of challenge them and make sure that they grow throughout the placement. And then all the time that they're doing a placement, then we'll work together to job seek. So they'll do a lot of kind of the looking around themselves, and then I can support them with things like application form process, maybe interview skills, or thinking about what they might say about their mental health condition in an interview, or where they don't want to say anything, kind of all those conversations around what they're comfortable with, really. So kind of work with somebody until they get to their interviews, and then once they kind of go into work, then I guess it's up to that person how much involvement and how much kind of in-work support they're going to need. So some people that I work with kind of don't really want me to, you know, speak with their employers or kind of work with them once they're in work. They kind of feel like, you know, the work's being done and they want to kind of go off and do their own thing now, which is fine. Or other people want kind of more kind of regular meetings or regular phone calls, or some people might want me to actually come in and, just as I would do with the placements, kind of do reviews in the workplace and see how they're getting on, and maybe help them with kind of one-to-one sessions if they have a particular difficulty with assertiveness at work or boundaries at work. Then I might come in and do a bit of coaching around that. Yeah, I mean, we have a lot of support within the organisation, and there are lots of people who are quite willing to work with the programme, but I suppose I want to have more people willing to work with the programme. I want to kind of spread it across the organisation, kind of like walking around the organisation and seeing my clients working in different areas. So I try and spread it out. So I suppose with new people that I'm working with, I might try to go in slowly. So I might try to just get them to have a one-to-one meeting with one of my clients to give them a bit of advice, to give them kind of advice around the particular industry that they want to work in. And so that's kind of a nice first step, because they're not really committing to anything yet, but they are kind of meeting with a client that I'm working with and kind of putting a person there instead of an idea there, because obviously, you know, we treat patients, and so I suppose for a lot of people it's difficult to kind of separate the patient from the future employee, I guess. So yeah, so trying to do those little things where I suppose you break down stigma and break down barriers a little bit by kind of introducing people, seeing how things work, trying to get feedback from other managers who've been part of the programme, and try and get them to comment on their experience and get them to speak to new managers that haven't been part of the programme before, so that they can kind of hear it from their perspective. I'll do things like maybe set up shadowing days, so people can kind of go in and just see how it works for just one day without having to commit to anything. And then I suppose it's about reassuring the employer as well, so they'll be concerned about things like criminal records checks and health clearances and things like that, because they want to make sure that they're doing the right thing, I suppose, in it, employing one of our clients or working with one of our clients, that they're not going to make that person more stressed and they're not going to make that person relapse. So I will reassure them that we've kind of done those checks, that we've spoken to the clinicians, that we've had kind of clearance from occupational health, so that they feel more confident that they're going to be able to work with that person. Yeah. And then I suppose it's offering them support as well, trying to have kind of a frank discussion with them, so that they don't see me as just there trying to work on behalf of that client, but also to support them as well. So trying to, as I said, talk to them about what some of their fears might be, and try to reassure them that that person is not necessarily going to be off sick all the time, or not going to be a lot of problems with absenteeism and things like that, because I think those are things that are the main concerns for people. I really enjoy working on both sides. I really enjoy working with our clients. I really enjoy working with the employer as well. It's quite a varied role. The clients that I work with are really motivated, they really want to work. And I think a lot of them are often quite brave to kind of push themselves and come into this programme knowing that they are going to be in work and that they may face challenges, they may face stigma, but they've still kind of got the guts to go and do it. Like, I really like that. And I suppose I think throughout my working in this field, I think I really appreciate how work is so important and work can be so beneficial to somebody. I suppose in terms of confidence, building self-esteem, and I suppose seeing people kind of do those things, be in the workplace and then have their confidence boosted is just a really fantastic thing to be part of, because that can impact their lives in so many different ways. So just through working, it can improve relationships and, you know, support people in kind of following other things that they want to do. So that's quite nice. It's quite nice to be part of that. And also, I think you get quite a good mix, because you are kind of achieving targets and, you know, working quite hard to create opportunities, get quite a buzz from that. But I suppose it's good that the targets really mean something as well. They're really worthwhile. So it's quite a motivating thing to do, I think. About 35 to 40 maybe coming through, or I suppose I'd meet a lot more, but I guess people that decide to continue with the programme and come through the programme. So I work with about 20 people on my caseload at any one time. And I guess, yeah, I would set up about 35 to 40 placements in a year. This year, 9 people that I've worked with have gone into employment, and some people supported with kind of in-work support as well. So it's really fluid and it's quite flexible, so it's not a set program where you kind of see people for a certain amount of weeks and you meet them every week for 9 weeks. It really depends on the person, depends on what they need, depends on what kind of support it is that's going to be suitable for them, that's going to work for them. So you might kind of have one person who's been on your caseload for a year, but you might have someone who's been on your caseload just for a couple of months. You know, that's happened, and it's a really, really quick turnaround. So I think I quite like that, very flexible and fluid. And I guess we've had really good feedback on the other side from clinicians as well. So clinicians that are working with our service users. That kind of once they had thought about their vocational needs and maybe referred them to us, that they had been kind of a lot easier to work with, kind of a lot more motivated, I suppose, in their treatment, because they had something, you know, to work for. And obviously, like I said, like the increase in their confidence has kind of made it, I suppose, kind of brought about maybe better outcomes or quicker outcomes, I suppose, treatment-wise. Yeah, so that's been good.
So you must be really pleased when you do get into work and like, yeah, we don't need you anymore.
Yeah.
I'm doing my job.
Yeah. Yes, but yeah, that's the best outcome, and it's nice to have the freedom to be able to say, but later on, if you do, then you can always come back, because I've worked places where it's just that you can't. Once they're kind of off of the caseload, they're off, and that's it. But with this, yeah, you do have that flexibility, and that's brilliant to be able to say to somebody, you could come back as long as we're here in a year's time. If you want support in your job, or if your job has ended for any reason and you want to find something new, then you can come back. Because often, you know, they won't, but it's just nice to be able to kind of give somebody that reassurance, so that they can kind of go off into the working world knowing that if they ever did have a problem, then they could come back. I think that's quite big, because kind of a lot of kind of different employment support would end at a certain point, and then they'd be, you know, fending for themselves. But yeah, working is a difficult thing for anybody, and problems come up. So it's nice to be able to use the clinical team as a resource. It's nice to be able to work in partnership with people that know your clients really well, from a kind of a different standpoint. I think I've worked with people in the past where I haven't known that much about them, which, you know, has its pluses as well, kind of meeting somebody fresh and not knowing anything about them. But yeah, there's kind of a lot of a lot of different expertise that you can draw upon when you can work with the clinicians involved with that person. Yeah.